So now we're trying to look at several types of inflammations. So different inflammations and different parts of the body that they could actually occur, you know. So we look at what is known as the orbital cellulitis. We look at what is known as the mastoiditis. We look at what is known as the jaw osteomyelitis. So that's like inflammation. That's infection rather. Okay, the last one is mainly infections. The other ones could be infections or any other thing, you know. So let's quickly go to them one by one. So for orbital cellulitis, it just simply means what? Orbital is your eye, you know. So, you know, it's infection of the soft tissues within the orbit, which is posterior to the orbital septum. Sometimes due to all those acute bacterial sinusitis, trauma, or dental infections, you know. So you have painful eyes, blood eyes, vision, fever, sometimes proptosis. Okay. So complications could lead to vision loss, could lead to intracranial spread, then cavernous sinus thrombosis. You know. So you treat by intravenous antibiotics, hospitalization. Then for mastoiditis now, it's just infection of the mastoid, okay, hair cells in the temporal bone. Usually following when somebody has had an otitis media and they have not treated it very well, you know. So there's a lot of ear pain, there's a lot of fever, there's a lot of swellings, you know. There's a lot of redness behind the ear. The later one is followed by all those ear discharge, you know, and the rest of it, hearing loss. So complications could lead to brain abscess, could lead to meningitis, could lead to facial nerve palsy. So since it's an infection most of the times, you treat it using all those intravenous antibiotics. Then they can also drain the middle ear fluid. That's if there's pus accumulation there. Okay. Then we're looking at the jaw osteomyelitis. So jaw osteomyelitis is just simply infection of the jawbone, you know, mandible more commonly than the maxilla. That's the down is more common than the up. So symptoms: a lot of pain there, a lot of swelling, fever, post discharge, you know, loose teeth. There's difficulties opening the mouth too. So complications: you could have a chronic infections, you can have bone necrosis and pathological fractures. Okay, so you know, treatment is long-term antibiotics, surgical debridement, and you manage any underlying dental issue there.